Good evening, my friends. My name is Jose Angel Anaya. It's a pleasure for me to share with you this video, this presentation that I prepared on CBASP, Cognitive Behavioral Analysis System of Psychotherapy for Persistent Depression Disorder. Um, Happy Thanksgiving, I guess, because today is a Thursday and has been a long day, but pleasant thanks be to God. So the first thing that I would like to talk about CBASP is the key concepts. The central constructs for this theory is, first of all, it was a theory developed by McCullough in 2000 as an integrative therapy developed specifically for persistent depression or chronic depression, and it combines elements from cognitive behavioral and psychodynamic techniques. And as this scroll says, combined with medication, it's a more effective than either or treating alone, either with medicine or just CBASP. Well, now, according to McCullough, what causes dysfunction in his theory? So he talks about the learned Pavlovian fears of interpersonal encounters. He talks about preoperational stages. When the patient comes, a patient that has been with a chronic persistent depression, the patient is actually disconnected with reality. And he even mentions that the patient is in a pre-operational state. So he's in a state of not being able to establish like a logical relationship with the reality that surrounds him, and also the connections and the reality that the person has with other human beings. So the person experiences a diminished capacity, and that is what gets this person into this cycle of depression and hopelessness, and it makes him incapable or makes her incapable to get out of that state. So what is the nature of this therapy? This therapy has several features. One of them, the first feature that we apply with patients is called significant other history. And in this part, what we try to do is, and we will see it in the case study, we are trying to elicit what is the people that affected positively or negatively our client, and how that affected the person's or the client's view on the world and on himself or herself. Then we have also what is called transference hypothesis. So what happens now in this person is because of his or her past. And there are two kinds of exercises that will help change these patterns in the client, and those are called the SA, situational analysis, or in the IDE, interpersonal discrimination exercise. So we'll start with the very first thing, very key thing we have to do for applying CBASP is the significant other history, SOH. This one has two goals. The first is to help the client recall how was it like growing up with these people that impacted the client's way of seeing the world, and how this impact informed the mind and the behavior of our client. The other goal is to formulate positive or negative influence from 5 or 6 people, and this actually it's for us because will allow us to determine what is the emotional stamp of legacy that that person acquired in his life. And what we get to this is to the transference hypothesis that we will explain ahead. And this significant other history is mostly for the benefit of the therapist. So now the significant other history, according to this book of McCullough and Pemberton, we will give this kind of a material. This is a handout that we have to give to the client. The session 1, we say, I want you to list no more than 5 to 6 people who for better or worse had a significant impact in your life, the big players of this person's life. In second session, we will review the list of people, And this will be done in two steps. The first one would be like, what was it like growing up around this person? And what are some memories that this person can recall? And the second step in this second session is, how did this person influence you to be the kind of person you are now? And then we're looking for the emotional stamp that this person has left in our client. Now, the causal theory conclusion and transference hypothesis. So, as I said, the significant other history will help us to designate one stamp, and the stamps in the stamp or the influence that the other people left are three themes that we will that McCullough is divided in distress, danger, or maltreatment. Now, the implicated theme is what is going to help us to do the transference hypothesis. So, in a single sentence summary of a theory about how the world works in the person's mind, and we will see it on an example. Um, for instance, in the example of the transference hypothesis, where the core fear avoidance is the domain, we will have the client saying, uh, if I make a mistake around my therapist, or if I made a mistake around my father, he will think that I'm stupid. So what we will do in the transference hypothesis, because that's what is going to happen with the client. The client is to transference in regard to us. It would be something like, if I make a mistake around my therapist, then he or she will think that I'm stupid. And this is the interpersonal distress, danger, or potential maltreatment found in transference hypothesis. So in summary, because I know this theory seems a little bit complicated, but once you get in touch with all the elements, it's actually very useful, even for severe depression, not necessarily persistent depression, but I would highly recommend. This has been a great experience for me throughout these weeks to delve into this theory. So, the summary: significant other history helps us to formulate positive or negative influence that we will deduce in what we call the stamp. Now, with this stamp, which is going to expose the domains, either fear, danger, or maltreatment, we will find this hot spot. What is the interpersonal distress, danger, maltreatment found in this transference hypothesis? And we will develop that in a little bit ahead. You will see that how it works. The interpersonal discrimination exercise and the situational analysis. We will deal with these exercises throughout all the therapeutic theory of CBASP. Now, the major techniques are interpersonal discrimination exercise, which the goal is to determine the behavioral consequences of the therapies and the interpersonal consequences as a result of a significant other's maltreatment. And the idea is to achieve felt safety. The client, and this is one of the things that McCullough and Pemberthy and some other experts say, we become like the center of, we represent humanity in the eyes of our client. We need to take very seriously the fact that we are the people they're going to start achieving felt safety. And that's why it's important to do well on our side as therapists, this discrimination, interpersonal discrimination exercise. And then the second exercise is called the situational analysis. And the goal is to demonstrate that behavior produces personal consequences. Clients are asked to formulate situational desired outcomes, and we will have an instrument to do situational analysis. This is one of the things that at the beginning we need to assess if the client is willing to follow all the exercises that and the handouts that we need to give them to do all the activities. So, and now I'm going to explain a little bit more in detail what is each of the exercises or techniques. The first technique is interpersonal discrimination exercises. That involves compare and contrast the experience getting close to significant others versus the present to describe the hurt and the pain associated to closeness to significant others, and compare what is the ancestors of hurt and pain that the client is feeling with the therapist. And as I said before, the goal is that the client may feel some safety around us. The steps of the interpersonal discrimination exercises, the therapist points out upsetting emotions in session, and that's what Pemberthy and McCullough calls hot spots. So we take that experience and we analyze those experiences in terms of transference hypothesis, in relation to the therapies. And then the therapist, as therapists, we point out what are the similarities and differences in the client's relationship with the therapist in this situation, and the experience in the formative relationship with significant others in the past. There's a lot of discrimination in comparison between the past and the present with the with the um, with the therapist. Now, one discrimination exercise here is one example. The therapist, and this is a little just vignette on what can how can that happen. The therapist says, you were 30 minutes late today for your appointment. When you were in high school, how would your father react had he found you been late to an appointment with a doctor? And then Bill answers, he would have told me I was a royal screw up and couldn't do anything right. He would also remind me that a son of his would never be late. Now we say, let me change your focus. How did I react to you being late? What did I do? And how did I look to you? Bill would answer, you told me that you were glad to see me. You shook my hand and offered me a seat. Now, as the therapist, what was the tone of my voice, my facial expression, anything else you remember? Bill, you sounded like you were glad to see me. You were smiling. Yes, you were glad to see me. Therapist, now compare and contrast my behavior with that of your father. Then Phil answers, well, there's no comparison. You were glad to see me. He would punish me whenever I made a mistake. Therapist, so what's the consequence of your experience from me today when you made a mistake? Bill, it was all right. You were glad to see me. Your reaction was very different compared to what I usually expect when I make a mistake. The therapist, if I turn out to react differently when you make mistakes compared to your father, what possibilities exist for you in this relationship? And then Bill would answer, I will be able to relax, not to worry so much about getting everything just right. So as I said, this is a simple example of the application of the discriminated exercise. Now, in the situational analysis, we will see the situational analysis is a problem-solving technique that we help and teach the client so that he may be able to realize what is the consequences of his or her behaviors and how to modify those behaviors to reach the desired results. These usually start with the third session. So the goals are how to act when facing a hotspot situation outside of sessions. And the other goal is show disappointing relations of client that are the result of expectations from the past. So these are the key learning skills we need to teach our clients. There's a lot of teaching and a lot of psychoeducational activities with the CBASP model. The first is focus on one problem at a time, not to have a global thinking, not to go like, this is the end, I can't do anything right, I'm hopeless. We need to help them to focus on one problem at a time. The second point of situational analysis is to highlight the problematic thinking and behavior problems that the clients present, especially in the way they interpret behaviors and problematic situations in their lives. The third learning skill we need to teach them is to identify social skill deficits. If they are shy, if they are not approaching, if they are not taking the initiative, we need to teach that. And the fourth very key learning skill is to teach clients identify interpersonal consequences of his or her behavior. Now, another instrument we need to use in conjunction with situational analysis is the coping survey questionnaire. So this is usually given at the session number 3 as a homework and assignment. And at every session, we need to work with the client to this coping survey questionnaire, CSQ, so that we may be able to help them to analyze specific situations. As you can see in this example here, the 5 steps, the first one is describe what happened. Write down or said clearly what was the event. The second step is how did you interpret what happened? There's 3 options for the client to interpret. The step 3, describe what you did during the situation. This person need to describe, their behaviors, the tone of voice, the eye contact or avoidance situation, whatever the person did. The fourth step describe how the event came out for that person. That is the actual outcome. What happened? And step fifth, describe how the client wanted the event to come out for him or her. That's the desired outcome. And in the end is always, did you get what you wanted? Yes, no, and why not? This is the coping survey questionnaire. Now, the role of assessment in CBASP. As you can see, the DSM-V5 gives us diagnostic criteria for persistent depressive disorder, and those are the descriptions. And in this model, we will also base ourselves on the assessment through the significant others history, depending on his histories of maltreatment or other traumatic events. And Pemberthy and others suggest structured clinical interview from the DSM-5, mini international neuropsychiatric interview, and as you can see, some other self-report scales, and I definitely like it. I'm very familiar with back depression inventory, and also the impact message inventory that is another self-report inventory to help us uh, discover what are the interpersonal reactions of our clients. The role of the therapist. McCullough says that the role of therapist is key in 4 aspects. The first, we need to enact a disciplined personal involvement in our clinical role. The disciplined personal involvement includes a lot of patients. He says we have to have at least 20 to 35 sessions. And this disciplined personal involvement includes that we must gain the trust of the patient. The second, the therapist is able to implement acquisition learning approach to therapeutic administration, being aware of all the steps and all the key elements and instruments that are used in this approach. The third point, the therapist is able to adhere to standards of CBASP technique administration. When you read the books of McCullough, which is the main guy in this approach, you will find that he insists that following faithfully these strategies, he assures the therapist that he's going to be able to help the client get out of that hole of persistent depression. The fourth point, the therapist is able to implement several facilitative interpersonal skills, which are done with already made instruments. In the end, we will see some references, and you'll find there in those references the instruments. Now, the role of the client includes also disciplined personal involvement to enable the client to identify his or her thoughts, emotions, behaviors, and past influences. The client has to have a willingness to analyze, evaluate the consequences of his or her actions, and understand the impact that how his behaviors have an impact in the desired outcomes. The third role is willingness to explore relevant childhood events, even if those are traumatic. And finally, engagement in the therapeutic process, which includes a lot of assignments and written assignments and a lot of um, instruments. Goals of CBASP therapy. So CBASP therapy is based on behavioral, cognitive, and interpersonal techniques. And the goals are basically to break the cycle of negative interactions to help the client reach emotional safety. Another is to improve these clients' personal relationships so that we help them to recover the empathic responsivity, which is lost in depression and chronic depression, to help the patient or the client develop more effective coping strategies, which we will control through the use of those instruments, and also to help the client to get ability to engage in informal operations in social problem solving. So the therapy final goal is to help a client reach perceived functionality. Now, a case example to demonstrate CBASP theory. Nate was a 26-year-old graduate student in medical engineer at a larger urban university. He was single and reported an early onset case of persistent depressive disorder. He grew up with a mother, stepfather, and one stepsister 3 years younger. The stepfather, beginning at 6, often beat Nate for misbehavior and demanded he adhere to a strict home regime. This included no snacks between meals and no bathroom trips after he went to bed. Nightly lectures occurred telling Nate that how worthless he was. Nate's mother remained oblivious to the stepfather's brutal behavior. He completed the childhood abuse questionnaire and scored in the severe range of extreme physical and emotional abuse and extreme emotional neglect. This situational analysis was obtained during the 19th therapy session. This is from McCullough, Schramm, and Pemberton. So, how do we apply the CBASP theory in the case of Nate? The first session, I missed the educational part. We need to do a very clear educational part explaining how CBASP works, what are the demands, what are the the part of the client to do in this process. Otherwise, if the client is not able to comply, it's very difficult to use this approach. But the therapist can conduct a clinical diagnostic assessment after explaining and giving the little psychoeducational talk to determine the presence of um, chronic depression disorder or persistent depression disorder. So, and then we once discover the severity of the depression and is already assessed and how suitable is the client, we start explaining the significant other history, which will be the second session focus. And the second sessions, we review the significant others history, which, as we said at the beginning, is what are the 5 or 6 people that mostly influence the life of the client. We assess the interpersonal impact that I would say, you might say that the fact that the mother never defended him against his stepfather, that would be a very serious um, um, influence, negative influence in his life, as the abuse, the verbal and physical abuse he received from his stepfather. Those would be for sure two significant other histories in his report. Then the therapist teaches how to work the situational analysis and the coping survey questionnaire. In the middle sessions, what we do is to elicitate the remediation phase based on the situational analysis. Each time the person will come with a situational analysis, developing events that happen in the life of this person, in the minimal relationship that he has or whatever that this person has, either at home or if she's living alone. And then we review this remediation from situational analysis, and also we will use the no, it's and the next one. The goal is to help the client to achieve perceived functionality. And of course, here's the one I'm looking for. The interpersonal discrimination exercises are used to discriminate the hurtful or threatening responses from the people in the patient's life compared to the one that he is receiving from the therapist. So this patient acquisition is assessed with the help of the situational analysis and discrimination exercise, uh, with the help of the relationship of the therapist. That's when McCullough says our input, our behavior, our reactions, the way we treat the patient, and our empathy plays a big role in this in the development of the functional behavior in the patient, in the client. Determination, the goal of CBAS is for the patient to be able to self-administer the situational analysis correctly. And with the achieve of this goal, we will terminate treatment. And of course, they suggest that we need to continue scheduling booster sessions at longer intervals to maintain and to prevent relapse from depression. And of course, as you might see in the reference at the end, McCullough insists that persistent depression disorder is not an episodic event. It's a condition, and he even mentions like somebody with diabetes or hypertension needs to keep taking their medications. Clients with a chronic or persistent depression disorder, they need to maintain this attitude of situational analysis, interpersonal discrimination exercises, and doing these coping surveys to be able to maintain the functionality of his behaviors. Now, a critique of CBAS theory. And you will find that this is a well-supported empirically therapy. Most of the documents and most of the documents that I got in the resource at the end say that in conjunction with antidepressants, they have like from 90 to 97 percentage of success with this. And here are the authors. And Pemberthy and Carlson said that proven effective in a 12-site national study with 681 chronically depressed outpatients. I would say as a Christian counselor, the important aspect of faith and spirituality would be the one to give further attention. It does not address either religious or cultural dimensions in the client, only stays in the behavioral and cognitive part of the person's situation. So this system is highly compatible with Christian values and worldview, but I would add that spirituality aspect as a source of comfort and support to the client. And I would reduce the strong emphasis that is given to the therapist. You know, the therapist in CBAS is the greatest source of confidence that the client should refer to. I would say if we are able, if the patient has some spiritual value, some Christian background, we would be perfectly able to help this person to refer not 100% to the therapist. Of course, they need to find a physical, personal model, a human being that they can trust and they can totally confide in. But we need to also refer to the greatest source of durable peace and confidence and trust that is our Lord Jesus Christ. So here are the resources that I highly recommend, especially those from McCullough. All the books of McCullough are very technical, excellent, with a lot of, and also the one with here, Pemberthy, Pemberthy and Carlson, and that they offer also all the instruments and all the materials that we can use to have a effective and successful therapy, CBAS therapy. And that's the end. I really appreciate your attention. May the Lord bless you and have you give you a wonderful day.